How are you, Lucy?
I'm very fine.
Wow. Welcome to the Mental Health Hub.
Thank you so much.
Welcome to the Mental Health Hub, Lucy.
Yes.
This is a platform for sharing matters mental health, especially meeting the professionals, hearing what is happening, what is new, and I am privileged to be part of this wonderful facility. Maybe can we get to know who Lucy is?
I am Lucy, a counseling psychologist at JABALI Wellness Center. We are a facility that offers treatment and management of addiction and substance use disorders and mental illnesses. Yes.
Yeah. Now, I have walked around here and I realize a very natural environment. How do you tie this up with treatment?
A safe environment or a natural and some nice and quiet environment is very essential when you're offering treatment, because the first thing you want to ensure is that your patient feels very safe. Security is one thing. You also want your patient to be very, very comfortable in that their most basic needs are met, such that they are sleeping nicely and comfortable, they are having good meals, and they are having a nice environment basically, because that safety, that comfortability is what makes the patient feel, now I can start my recovery process.
This is so homely.
It is. It is a home away from home.
A home away from home.
Yes.
A place that when a client comes in, even a family member walks in and sees this, you are actually trying to rejuvenate this person, to bring them closer to nature, and probably remind themselves of the natural them.
Of their old personalities, of their old person. Now we are trying to remind them this is an environment, a home whereby, home, we always say home is a safe place. When you hear someone saying, me, I want to go home, it's somewhere that they feel safe. So we want, when they are here, they feel very safe. They are not stigmatized, they are not discriminated. When they get inside of that gate, it is a place that you should be safe. A place where you're not stigmatized, you're not discriminated by anyone, and now you can actually now start opening up. Okay, we want even the family members, when they come to the facility to see their patient, they also feel the homely environment in the first place. We don't want to institutionalize this place like it's just a hospital that you walk in and you do your business and then you're out. We want them to feel safe as well. A safe environment where we can all sit down, have a session, talk our issues, and be able to get help at the end of the day.
It's like, as they engage with the nature, as they reason, as they get back to themselves, this person is actually seeing. I mean, there is something I missed in my life for some time, and there's some kind of a future that I can reach out to, and the support mechanism is there. I am not alone in this.
Yes, and actually even our setting, the basic setting that we have, it's a setting that encourages family. We have a dining area where all our patients sit down and eat together during meals time, because we want for them to remember how did we form these social connections in the first place. Because remember, some of these patients, they have been involved in substances for the better part of their lives. They forgot the family unit. Some of them are not even present as parents or present as brothers or siblings. So even our basic setting encourages us to be together, to work together as one community, as one family.
Wow.
Yes.
Looking at where they live, it's like it's a setup where you can be able to see that you are not alone in this facility. It's like you have a brother, a sister with you. I don't know what that registers.
We encourage them that it's a small community. It's a small family that we have, such that you will even see whether when a patient notices the other patient is struggling with something, they are very quick to help. Which is very similar with our families. When you notice your child is struggling with something, you're very quick to grab it and help them. So our basic setting encourages that togetherness, that working closely and having those close-knit relationships, because that is the source of our support. And this recovery is recovery that requires people to work together, and the addict or the person struggling with the mental illness or the substance use disorder needs a lot of support. And when they start forming those close relationships, it is very easy for them to go outside there and now start re-establishing the ones that they already abandoned with their family members, because they already have those basic skills that they have acquired here. It's now going to just to put them in use and bring that close relationship that they have with their family members.
Wow. It's just like reconnecting to the society again.
Yes.
I've actually seen that you have some equipment that they have access to.
I don't know. We encourage our patients. We have what we call occupational therapy because we are trying to form new behaviors at the end of the day.
Sure.
We are trying to help them realize maybe hobbies they never knew they had in the first place.
Sure.
So that is why we have different activities that we offer. We have a fitness place where our patients engage in toning their bodies, I can say. Toning, for lack of a better word, toning their bodies. And it also keep mental, one way of improving the mental health is also exercise is one way, because you find a lot of dopamine is produced when you're engaged in these kind of activities. So we encourage a lot of occupational therapy because we want the patient to go outside there and actually do things and have fun in doing them without actually engaging in the substance.
Wow. It's like gaining a new behavior that can be
Yes.
replace.
We are trying to replace the old behavior. So we can't just eliminate the old behavior. We need to instill a new behavior. We need this person to learn new behaviors. So as much as they are abandoning that behavior, this one is replacing the old behavior.
Okay. And of course, as you have put it, knowing the fact that substance use affects the brain, you bring in the feel-good chemicals that exercise releases.
You know, some of these people, they actually ask, how can I have fun without drinking? Some of these people do not know how fun you can feel without drinking. And when they actually engage in these activities and they feel, I'm so fresh, I'm so excited, it teaches that them you do not need the substance to feel these feelings. You can have fun without drinking. You can have fun without smoking.
Wow.
So that is what we are trying to teach these people, and to try for them to acquire new behaviors and new hobbies. Some of them come and realize, I have never tried working out, but I've worked out. Actually, I like it. So they adopt it. You see, they even subscribe to gym when they are out of the facility. And maybe it's something that you have never thought in the first place in their lives. So some of them learn new behaviors, and some of them strengthen old behaviors that they had. Maybe they had abandoned previously. Now they start doing them again, and actually now engaging in them again.
Ah, great. Yeah. Let's see what else we have.
We have both indoor and outdoor games, as I've said. We do have a pool table that people engage in pool. We also have a table tennis. We have indoor games such as Monopoly, we do draft, we do Scrabble, or just to keep the patient even engaged, you know, and to have things that they can do for fun as well in the facility. You know, some people think the facility is just a boring program that you just go read, be cancelled and all that. But we also try to show them recovery is fun as well, and this is the fun part of the recovery. Yes.
It seems like really science has improved.
Yes.
Because then from a punishment kind of approach, it becomes more lively.
Yes.
When the person is engaged and with others playing together.
Yes, even the therapist, we actually have an exclusive day for sports. In that a whole day we are all engaged in these sporting activities. We do have competitions, and this excitement, this thrill that people get, it shows them it is actually fun to be sober. It is fun to be in recovery. It is good to be in tune with my own feelings, with my own emotions, with my own self when I'm having fun. Because these are people who have been used to having fun when they are intoxicated. They have never experienced this when they are sober. So it is a new feeling for them. It is a new thing, a new experience for them, which we are trying to reinforce.
Wow.
Yes.
Wonderful. Great. I think it's a nice approach to treatment.
Yes.
It seems to really have some kind of influence on this person and trying to make the person participate and feel like they have value for themselves and even the connection with others. And as you rightly pointed out, to try to reach out to their hidden resources within themselves as they activate the body, activate the mind. And besides being a way of spending leisure, it's a way of also learning and learning and relearning
new talents and skills that you never thought you had in the first place.
Wow, wonderful.
Yes.
Great. We have seen the occupational bit.
Yes.
We have seen the environment and how it can actually influence treatment for this person in treatment. I want to hear the place of the professionals in treatment. Why is it important that we actually have professionals doing this work?
Professionalism is key in treatment of substance use disorders and mental illnesses. Because in the past, people have not realized addiction is actually a disease. It is a disease that requires treatment. And addiction or substance use disorders, they have a very close interplay with mental illnesses. Either of those can induce the other. Without professionals or without people who know what actually they are doing, we may give the patient a disservice at the end of the day. A patient might have an underlying issue, but because you're not qualified to assess and to diagnose that particular illnesses, you actually miss it. And this means that the patient will not get the treatment that they require. They will not get the medication because our treatment is a combined form of psychotherapy and there's the pharmacotherapy bit of it. So if, for instance, a patient has an undiagnosed depression and you've not identified, it means they will not get medication. Then this depression can trigger back this substance use disorder. So professionalism is key because we want to offer the best quality services. We want to give the patient the best treatment that can possibly be there. Even with the nursing, because we have a nursing department that operates here 24/7, nurse is a very crucial component in this treatment because these are people who an issue might just pop up. Maybe a patient went through detoxification, their blood sugars are very unstable. If the nurse is not qualified enough to see what are the key pointers of a patient struggling with hypertension, what are these things that I need to identify before this patient reports I'm having maybe a headache, or they should be able to identify these things in the first place. Psychiatrists of giving medications. So professionalism is a key thing to ensure that the patients receive the best treatment and the right treatment, to be very specific, the right treatment.
Actually, in this profession, we talk of do no harm.
Yes.
It's a benefit for them.
Yes,
benefit to the client.
Yes.
And all these require a professional to actually be able to deliver.
Yes.
Now, as professionals in this field, how do you build your skill? How do you ensure that really you are current? Yes.
It takes a lot of reading. I think mental health is a field that is evolving day by day. So even if you have a degree of maybe psychology or medicine, it's a field that requires you to read a lot. Because you see, different, especially mental illnesses nowadays, are presenting themselves in a different way. For instance, there are somatic symptoms. Maybe someone is struggling with somatic symptoms, but maybe the real issue is a mental illness.
Sure.
So it's a field that requires you to be at part, to read, to be able to actually be there when dealing with these patients. Yes.
On a daily basis, what is the support available to the therapist that is working with the client?
For instance, in our facility, we have what we call supervision. We have our own therapists that we go to. This ensures that you're not burnt out, you're not overwhelmed, so it keeps you fresh when you're dealing with issues of the patients. We have clinical meetings every day, and we share as counselors what challenge am I experiencing, and we all brainstorm on possible solutions that we can be able to help each other.
Besides likely also going for counseling for your own issues?
Yes. Beside going to counseling, and we are advised as therapists, you should have your own therapist. Because sometimes I also know the job can be overwhelming, and you can forget yourself at the end of the day. You can forget your self-care. So we are also reminded to have this other therapist now with our own issues, that they will help us to be in tune also with our own emotions as much as we are helping other people to be in tune with their own selves.
So a helper should also get the necessary help.
Yes.
A helper should ensure that they are practicing, having the relevant competencies, having the relevant skills and knowledge, and of course keep updating themselves with emerging issues. Because as you say, this field is quite evolving, and many issues present in different ways. The sharing of experiences with the other therapists who have seen a client and know what it is all about.
And consultation. Do not die with a case. Consult. There are people who are more experienced than you. It gives you a less burden. When you're alone trying to figure out everything, it can be overwhelming. But when you do consultation, it really helps. And it helps you manage a patient in actually the best way. Consultation is also key in this field. Yes.
But what I hear coming out, either from the facility, the goodness or the setup of the facility, from the services that are offered, is basically the client care. It's like the focus is the client.
Yes. Our first priority is our patient. We want to ensure the first thing when the patient gets inside our facility, they are comfortable. As I said earlier, we want to offer the best food. We check the nutrition of our patient, the health care of our patient, and now the counseling part. We want to ensure that all around the patient is getting the best care that we can possibly give. Yes. We are client-centered.
You are client-centered, that is the word. Client-centered.
Yes.
So that out here, as a parent who is having a child, as a family member who is having a family member requiring support, know that the services that are rendered at a facility are client-centered. And as I hear you speak, is that the client as other people that they relate with, the family, to some extent, services are extended also to the family.
Yes, we have what we call family-involved therapy, because we say addiction, to be specific, is a family disease. When one person is struggling with a mental illness in the family, every other member of the family is affected in a different way. So as we are offering this treatment to this particular patient, we're involving the significant others. We want them to be on the same page with us. If we are treating a depression, we want them to understand what is depression, how does it present, so that in the future, if a relapse would happen, these people can actually point a relapse before it happens. They can say, the way this brother of ours is trending, there is something wrong, because they've been psychoeducated. Because one thing, lack of knowledge is one thing that is perpetuating some of these illnesses. Instead of us supporting, we are condemning. But some of us, it's because we do not have this knowledge that we require. So we work with the family. We educate them on how do you support this person, and also we offer some sort of therapy to them to also enable them to heal from what they have gone through when trying to help this recovery
person in their family.
Yes.
Or even at the workplace, not necessarily even at the family level.
Yes.
Even at the workplace, these people are also supported as well.
Yes, we involve also the family, the workplaces. We have had supervisors coming to visit the patients at the facility, because you find maybe maybe one patient, one of the elevating issues is work-related stress. So if we do not inform this employer, such and such conditions at your workplace can result to mental illnesses to your employees, they will not know. So they are also able to know when we are receiving this patient back to our workplace, this is how we will support them. We will eliminate this and this, or we will adjust this and these conditions to be able to suit our employees and to ensure that our employees have good mental health.
That goes a long way in prevention. At the workplace, at the family level. And I'm looking at this and seeing we are in a festive season.
Yes.
This December.
Yeah.
I don't know as a professional what you will tell the community out there, how can we indulge without putting ourselves at risk of developing mental health disorders, and especially substance use disorders? What is your advice?
This is a good time because families are together.
Yeah.
Let's reach out. Okay? This is a time that we have those family gatherings. If we notice one of our family members is drinking excessively, before condemning the act, can you maybe inquire are there issues they are going through? If we have a patient, or if you have a family member who is a recovering addict or someone in sobriety, let us ensure we have a safe environment, because I know we will have alcoholic drinks at home. Let us ask ourselves, are we a trigger to this person in the first place? So let us understand each other, let us reach out. It's a season that we are all together. We can be able to identify if one of us is struggling. So let us reach out. Let us reach out to people. Yes.
And not to be silent, struggling alone. Yes. We can be able to remove triggers in the place of the people in recovery. We can be able to support our own, because the home front is a very important part in prevention. I believe that prevention should start at home.
Yes.
This is a safe, so to speak, environment.
Yes.
So in the safety of the family, one can be supported not to start substance use. In the space of the family, one can be supported to be in sobriety. In the space of the family, that is where recovery can be enhanced. So the family forms a very important place for prevention. The family forms a very important space for treatment. The family forms a very important space for management of substance use disorders. So it is important that we begin, especially as Lucy has informed us, as families come together in this period of festive. It is important that we ensure that it will not be a time to perpetuate substance use. It is not a time to put the guns down, and if you're on treatment, then you relapse. So as families, as community, as an individual out there requiring help, seek help. Reach out to the family, reach out to a friend. Be not a person that will let yourself get into substance use. In the event that you notice some of these triggers, some of this behavior that points to one who is at risk or one who is predisposed to substance use, reach out to professionals. There are many out here that can be able to offer the help. As I've always said, prevention is better than cure. Let us emphasize more on prevention, so that then we can reduce the cost of treatment, so that then we can reduce the challenges that the society is faced with because of substance use disorders. Remember to like, share, and subscribe to the Mental Health Hub.